Our fourth project was based in Northern Ireland and was led by Professor Sonia McIlpatrick from the University of Ulster and Professor Donna Fitzsimons, who at the time was working within the Belfast Health Trust and is now based in Queen's University Belfast. This project looked at the important issue of carers and particularly the role of home caregivers to people who have palliative care needs. We are very aware internationally and certainly in Europe of the high number of female caregivers that are expected to provide or required to provide care for their family member within their own home. The challenge of this is that often the caregiver themselves has health problems and is unable to provide that care or is only able to provide some of that care without strong supports from the health and social care system. So this project was looking at the impact of caregiving within the home setting. Palliative care has revisioned its focus in recent years to ensure that we include people who have both malignant and non-malignant disease. And this project focused particularly on heart failure. We know that heart failure is a particularly critical problem for Western populations, but sometimes it's referred to as a hidden problem, and therefore it was somewhat difficult for the researchers to actually identify people in the community, partly because much of the care is provided by GPs and therefore the patients may or may not necessarily be easily visible or accessible. They used interviews with people who had cared for somebody with heart failure who had already died and learnt very clearly that some of the challenges that they experienced were being isolated, not knowing how to access services. Even if they accessed services, how things were explained to them was not always clear. There were issues around how bad news may be broken, or even how the conversations around death and dying were described and discussed by healthcare professionals. The area of heart failure is certainly an important one within palliative care. This study will feed into larger reports, particularly by example from the European Association of Palliative Care, who are about to bring out a European guideline on the management of heart failure and particularly around the support of caregivers.